almost zero with this protocol. Again, I apologize, I don't know your ability to set that up in the clinic setting, but that is something that we do standardly here in the U.S. Okay, a couple other questions. Can an individual having HIV get a job? Will it preclude from getting a job? In general, no. So there are a lot of legal protections in the U.S. about patients' right to privacy and sharing patients' information. But I generally tell people that there are not many jobs that you can't get with HIV, particularly if you're on medications, because there are not that many jobs in which you would expect, high risk of blood exposure or sex exposure. So they probably should not get a job as a sex worker. They probably should not get a job, donating blood. But outside of those situations where there would be clear, exposure risk, casual contact is not a reason for people not to be able to work. Most of my patients work. I have patients who are physicians, who are healthcare providers and see patients. Different hospitals have different protocols specifically on surgeons and people working in the OR because of a potential higher risk there. But that doesn't necessarily preclude people even from being surgeons, although that is a sort of a special category that really depends on the hospital and the clinical setting. But almost any other job, working in a store, working in a restaurant, working as a chef, that I have patients doing all of those. That is not a way that people can transmit HIV. So yes, people should definitely get a job. If any healthcare provider gets an accidental needle injury from a patient in hospital, what should you do immediately? So that was actually just what I just talked about. The most important thing, I will just add to that post-exposure prophylaxis protocol, is time. So the PEP has been shown to be effective up to 72 hours afterwards, and most effective within the first hour to 24 hours. This is not something you can do a randomized controlled trial on, so we don't have really solid data, but it seems to be good up to 72 hours. But the most important thing would be obviously wash the wound out thoroughly, basic first aid protocols, take your first dose of post-exposure prophylaxis, and then deal with checking the renal function of the person who got exposed, checking the HIV status of the person, of the patient who exposed the staff member, and then deciding whether you need to continue the protocol or not. Is there a vaccine against HIV infection? Unfortunately, no. There are a lot of studies going on to try to find a vaccine, but we do not have a vaccine available against HIV infection. There's also no vaccine against hepatitis C, unfortunately, yes. Problems in Pakistan is we do not have well-developed insurance system. So I agree. I mean, I'm not sure that we have the most wonderful insurance system here in the U.S. And Dr. Galani and I take care of a lot of people who have no insurance as well. So I would say that, really thinking about HIV from a public health perspective, what are the systems that we can set up in terms of are there public health clinics that can care for people living with HIV? And that is something I'm sure people are looking at. Without insurance, the drugs are expensive, and most people cannot afford them in the U.S. Even in countries where the cost is lower, people often can't afford them. But not having a fully developed insurance system does not preclude having a good HIV treatment system. Many of the patients we care for in our clinic, I think 28% of the patients in our clinic are foreign-born. Many of them don't have access to U.S. insurance systems, so we see them through our federal program. Can a human with HIV transmit infection? So in general, so yes, the way people get HIV is from other individuals, but really only from the ways we talked about: blood exposures and sexual exposures. I'm sorry. And dirty needles, right? So reusing needles. So if there's blood, even if it's microscopic, if there's blood in the needle from drawing from one person, you go to the next person. The first person has HIV, you can transmit to the next person. There's a separate talk on this, but maternal child transmission through childbirth and breastfeeding is another possibility. If I get a needle injury from a patient who is suspected of HIV, do I have to get his or her consent for testing? So that's a something I'd have to defer to someone in Pakistan because I don't know the legal system there. Here in the U.S., it's very state dependent about testing. If a patient declines testing and we are not allowed to get them tested, we do still have the post-exposure prophylaxis protocols that we know are effective. And so if we can't confirm an HIV negativity in the patient and we're worried they might have HIV, we do the full 28 days of post-exposure prophylaxis with the healthcare provider that got exposed. And that way, we're protecting that provider. Okay, I think that was all of the questions on the list. I'm happy to take more questions.
Thank you very much, Dr. Garner. And now our protocol is we will give this speaker to Dr. Aziz Somru, and he will give chance to one person from each group, please. I know there are many people trying to introduce their protocols, their institutions, so please one person from each group. And a small comment on Dr. Garner's 90-90-90 campaign is like if you start thinking about Pakistan, I think we are on the other side of the spectrum, 10-10-10. But we are starting now, and all of us together we can make more development in this and can achieve this goal in a few years. So Dr. Aziz, can you start introducing one group at a time?
Hi, Dr. Garland. This is Dr. Sunru from New York.
Hi, Dr.
Yeah. So I'm going to introduce Dr. Sikandar Mehmun. He is in charge of the HIV program in Sindh. Dr. Sikandar. Dr. Sikandar, go ahead.
Assalamu alaikum.
Dr. Sikandar, just 1 minute, please. Give us a minute.
Yeah, you have to unmute yourself.
Can you please unmute yourself? Dr. Aziz, we cannot hear him. Can you please tell him to unmute his computer?
Okay. Assalamu alaikum.
Yes, now it's
Assalamu alaikum,
fine.
everybody. Thank you very much for arranging this very useful and informative session for the doctors of our community, province, who would be able to give their treatment to the patients as well as to give information to the general population, which is now suffering a lot, because initially it was a disease of key population that is called high risk population, but nowadays the emerging situation is alarming for we people, and it is in general population. And out of 25,000 people, we have 750 cases positive. Out of 750, we have 600 children. So I would must thank to Dr. Aziz and other all stakeholders who are sitting and viewing this all. And the people who are available in Sindh at LUH Hyderabad and Gambat, Larkana, everywhere, they all are requested to please gain knowledge from the senior clinicians who are available on the webinar and giving us a lot of information about the patients during treatment and other things, preventions. And please participate in the community, because this is the need of the time to go in the community and aware them. And there is a big fear in the community that if this fatal and dangerous disease is coming in general population, people are very much worried. So besides our community workers, community health workers, and some of the volunteers, NGOs, we need support of the doctors who are clinicians treating the patients, particularly pediatricians, they all are requested to make awareness among the community that there is no danger if someone is kept on treatment and he's continue with the treatment for long life. So their motivation and awareness among the community will help us a lot. And I would suggest Dr. Aziz that spread it across the province. I will help also because I have been asked by my secretary to ask every teaching hospital and district hospital to be available on webinar from next session. Inshallah, I will make my all efforts to make available all the doctors on webinar on district level basis. Thank you again. Thank you again. I'm very much thankful to everyone.
Dr. Moin from the 7, please. He is in charge of Abdullah Shah Institute of Medical Sciences. Dr. Moin.
Yes, about yourself.
Dr. Moin, can you please unmute yourself?
Dr. Moin, can you hear us? Okay, I will go ahead to the Larkana Center. Dr. Murtaza is an ex-Vice Chancellor of Benazir Bhutto Medical University, if he has any question.
I'm Dr. Shantilal, a pediatrician from Shahid Muhtarma Benazir Bhutto Medical University. I have a question to the speaker. Can you suggest that because HIV is now epidemic in our area where every pregnant mothers, children, even adults are suffering from, can you give us 1990 model to our area so that we can control and early detection and treatment of the cases?
Sure. Let me unmute myself here. I would say that the way 90-90-90 happens, or the way to implement 90-90-90 is different in different situations. I will say that if one thing that I think would be important in given the particular situation that you have described is making sure that all pregnant women are do get testing for HIV, both for their own health and because of decreased transmission. Women who are treated for HIV, pregnant women who are treated for HIV, if they get undetectable by the time of delivery, generally do not transmit HIV to the infant, and that obviously makes a significant benefit to the life of the child and to the future of the family. How to get to 90-90-90? There's sort of those three. I'll say obviously we haven't done it here in Rhode Island yet, so I can't give you the magic way. But the first piece is sort of getting a sense of the scope of your patient population, so testing. And really, I think that one of the other physicians earlier pointed to an important change where this was, previously in high-risk populations, and now we have are seeing more in the general public. And so thinking about how you can implement more widespread HIV testing campaigns and figure out are there different risk factors occurring in Pakistan than there are here, for example. And I don't know enough about the background of the situation, but was there vaccination protocols that would have included sharing needles that might have potentially exposed more children, et cetera. So figuring out what the new risk populations are and making sure you have broad diagnostics, testing campaigns, because that's really the first 90. You want to get 90% of the presumed infected population diagnosed, because if they're not diagnosed, they're not going to get anywhere further on the spectrum. So it sounds like the stage you guys are in really would focus in on that. But then you have to be prepared to do something when you have someone who's positive. So what we have learned in our campaign across the state, Dr. Dwani and I, has really been having to set up sort of networks. So social service agencies that are willing to work with people with HIV, and clinics that are able to accept them. So when you have someone with a new diagnosis, you can capture them before they're lost, out in the world. And that really is what gets you to the second 90 and the third 90. I guess the third 90, also figuring out some standard treatment algorithms. There may already be a Pakistan-wide standard treatment algorithm for standard first-line therapy, standard second-line therapy. But if not, the WHO has good models, and many countries have published their treatment guidelines based on what drugs they have available. And based on the list of medications you have currently, you certainly have medications for standard treatment first-line regimen, and should focus in on getting some drugs available for people who might need second-line therapy. I don't know how much of an answer that was, but I would say testing campaigns and then setting up both social support systems and clinics to have a way to capture people once they're diagnosed.
Dr. Sumro here. I will give a chance to Gumbert Institute of Medical Sciences if they have any questions.
Thank you so much. I am Dr. Shamim Bhatti from Gumbert Institute of Medical Sciences. No question yet. Thank you so much.
I'm sorry,
Dr. Shamim, we cannot hear you well.
No question yet, madam. Are you hearing me?
Yes.
Yes.
Thank you so much.
Yes, Professor Murtaza Pathan speaking, and I appreciate the efforts of my colleague and son of Sar of this area, Dr. Aziz Sumro Saab, and he made the efforts regarding the crisis in this population. And I also want to share the experiences of such type of outbreak. Share regarding the issue and help to solve the problem at the yet which we are facing in this crisis. Thank you very much.
So this is Dr. Rizwan Naeem. I also want to introduce another very important team member from the United States. His name is Dr. Hamid Jafri. He is an alumnus of Sindh Medical College, and he is one of the directors of polio program from CDC in Atlanta. He's online, and I would like to ask him a brief question. As you may all know, that there is a team of CDC and WHO in Islamabad and now in Sindh also investigating this crisis. So if Dr. Hamid Jafri, would you please unmute yourself and say a few things, what's happening with the CDC team and WHO team and how we can help, especially the people on the ground.
Dr. Jafri, can you please unmute yourself?
Hamid, Dr. Hamid Jafri, did you hear my question? Dr. Hamid Jafri, can you hear us? Hamid is online and is replying me back. There might be some technical issues. one of the operator, I think one of us need to unmute him. He said the operator need to unmute. So Iftihar and Fiza, can you please see and unmute him?
Yes, we are trying. Yeah, just a minute.
Okay, hello. Can you hear me?
Yes. Now we can.
Okay, Assalamu alaikum, colleagues. So this is Dr. Hamid Jafri. As Rizwan mentioned, that there is a team of WHO experts that arrived in Karachi earlier this week, and that team includes 2 experts on HIV from the HIV program here at the U.S. Centers for Disease Control, and they are on the ground to take this investigation of this outbreak to the next level after the initial investigation that was done by the FELTP program. I'm sure Dr. Sikandar from the Sindh HIV control program is working closely with them. They've just arrived, but we are already hearing important details. And I think one of the challenges, as you may already know, is with the availability of appropriate HIV testing kits and the testing protocol. So I think one of the areas that CDC and WHO would be looking at together is to making sure that the appropriate standardized testing material is available to Pakistan, and in fact at CDC they're looking at emergency procurement of some testing kits to make sure that the testing continues in a standard manner. I think the other outcome of this investigation, of course, we are looking forward to is a much better understanding of the risk factors and the source of this outbreak, so that the preventive measures can be appropriately taken and targeted, not only in this area of Larkana, but in fact more generally across Pakistan. And thirdly, of course, there is going to be a lot of aspects that were being discussed just now. I'm very thankful to the Brown University experts and Rizwan for the kind of education that they are imparting on treatment of that would be necessary for the affected children and the general population, and setting up the program for the 90-90-90 targets, I think would be, of course, very important. And most importantly, I think we will need a very sophisticated and intense approach to handle the challenge of stigma in the community. That really has to, because I think it affects families, it affects healthcare providers, everybody, and we need to really destigmatize the situation very rapidly. What I'm going to do, that after we have, after the team has been on the ground for some time and are starting to reach their own conclusions, I would like to connect this webinar team with the WHO and CDC team, so that there can be a common approach to training, common approach to how we can support our colleagues and clinicians on the ground in Sindh in managing this outbreak. Over from my side. Thank you.
Thank you very much, Ahmed. That will be great, and we would love to join the teams.
Absolutely.
Thank you, Dr. Ahmed Jafri. Dr. Garland, Dr. Sumra is from the King Faisal Medical University in Saudi. He has a question.
Well, thank you, Dr. Garland. It has been an excellent presentation, along with improving our knowledge regarding this important topic and the outbreak of this disease in Sindh, particularly in Larkana. Certainly, it will improve our knowledge and understanding, and the public will be brought into more awareness of this program. Hopefully, local agencies, along with support from international agencies, they'll help to improve the diagnosis, treatment, improve the quality of our community. Thank you very much.
Thank you.
Yeah. It's a question from Mr. Tarshe about please develop a flyer in Sindhi. We will try our best. We will create the flyer in English and Urdu. and then we will send that to Mr. Somru or someone in Larkana so they can translate that into Sindhi. Thank you very much. Dr. Somru, Aziz Somru, is there any other group want to join? Cast him unmute. Dr. Somru, can you please unmute yourself? Aziz Somru. Is there any other person?
I think he's lost for some reason. I'm calling him.
Okay. Is there any other question from the audiences?
Hello, Dr. Garland. I am Dr. Penwell from Saskatchewan Cancer Agency here in Regina, Canada. I have a question. Sorry. That in Sindh, the used syringe is a common problem. Our general practitioners, our healthcare provider in rural areas, they use the used syringe and then they throw it out, and then these are collected by the people and sold in factories, and they again just clean them or wash them and put them in the market again. So my question is that for how long, suppose a syringe from HIV patient, for how long the virus can be survived on that needle?
Oh, in a syringe?
It's a good question. It's a good question. I don't know that I can give you
a great answer on that. The HIV virus can't survive too long outside the body. A higher risk is actually from hepatitis B, which can last a very long time, and hepatitis C. HIV can't last that long outside the virus, but I don't want to put you an exact number because I don't have one. I don't know one off the top of my head, but I would think a couple of days. I think that the issue with transmission from syringes is threefold for the HIV, hepatitis B, and hepatitis C, and then secondly, but in terms of the issue of transmission, it's probably from immediate reuse of syringes more than a syringe that's been sitting out for a long time. I can't give you an exact amount of time, so I don't want to speak out of turn there. No, do you happen to know?
So actually, what I heard,
yes.
Sorry, this is Dr. Hussain. So what they actually do, I heard that they have a 10cc syringe with the same needle. They give an injection to the kid 1cc each. This is what I heard. And number two, on the same day, and number two, they are not using a clean instrument for circumcision and also body piercing. And they are not using the clean. On the same day, they are using the same instrument on the patients. I think, and also the other thing, to the kids, if they had 1 liter of glucose bottle to give kids, they gave 250 cc of IV fluid to one kid with the same needle they go to the other places, to other kids. That is where I found out. In old ages, they used to give injection in the army like 50 years ago with the same needles, and in developing countries, they are still using the same technique.
I guess that's a high risk. A syringe that has been discarded, and it's been several days. The risk of HIV from that needle was very, very small. It really is, again, hepatitis C and hepatitis B, but I think that the immediate reusage is, as Dr. Hussain alluded to, is probably the high risk that potentially could be part of what's going on here. Again, we don't know. That's what the CDC and local officials are looking at, but that would be, I think, what everyone is worried about. I don't know, what is your perspective in Saskatchewan?
No, in Saskatchewan, in Canada, there's no issue of the EU syringe, so I don't have local experience of this. I'm just talking in the perspective of Sindh and Pakistan.
Yeah, no, it's a fair question. I'm sorry, I don't have the exact answer for you.
No, thank you. I understand. Yeah.
So, Dr. Samro, Aziz Samro, do we have any other group here? So, if there's no other question, then we will talk next Sunday. Our plan is to do HIV treatment, and I think most probably Sunday will be on pediatric HIV patients, and then next Sunday will be on pregnant women and adults. And we will try our best to include all of your questions. So please, and I just have a request from Mr. Maiman. If I can get a list of all medications which are available in different hospitals for pediatric as well as adult HIV children, I will send that list to my colleagues, and then they can design or they can suggest the treatment options for you. And please prepare your questions for next week treatment sessions. And we are sending an evaluation form to every one of you. So please, it takes only 1 minute. Please fill it out and send it back to us. That is our way to collect more information and need assessment. Thank you very much.
I want to add, if you're listening, for any other centers in Sindh who want to join us, please let us know. We'll be happy to add as many as we want.
So if there are no other questions, we will just end our presentation with this one slide.
And I want to thank you, Dr. Fiza Jilani, Iftikhar Hussain, and everyone who contributed, Dr. Garland, of course, taking time on this busy Sunday and from your personal time and being here with us. We truly appreciate that. That's a service to humanity, and we all are very grateful for your services. Thank you so much.
Thank you for joining us, and Eid Mubarak, everyone. Eid Mubarak in advance. Enjoy your day and join us next Sunday. Thank you very much.
Thank you very much too. Yeah, thank you.
Thank you, everyone.